In this short video, we will cover the definition of burnout at work, the early warning signs of burnout, and what to do if you are experiencing burnout at work. Let's start with understanding what burnout is. Burnout is a syndrome resulting from chronic workplace stress that has not been successfully managed. It's characterized by three dimensions. Firstly, feelings of energy depletion or exhaustion. Secondly, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job. And finally, reduced professional efficacy. This definition is from ICD-11, a manual that classifies diseases. The ICD definition classifies burnout as an occupational phenomenon, a condition that relates to work. If you are worried about burnout in yourself or anyone else, remember work can also be informal and work can also be unpaid. For example, there are almost 6 million unpaid carers in the United Kingdom. What are the early warning signs of burnout? As you can see from the ICD-11 definition, work-related stress is a prerequisite to burnout. Work-related stress manifests when workers are exposed to excessive pressure. We know specific domains of pressure contribute to work-related stress, including, for example, demand that outweighs resource, and workplace relationships placed under strain. Organisations that want to address burnout should always look upstream at risk factors for work-related stress. Symptoms of burnout to look out for include persistent fatigue, lack of motivation around work, with negativity and feeling cynical towards work. It's important to remember that burnout is often associated with reduced workplace performance. Another factor to consider is that burnout can contribute to other changes in mental state, including anxiety and low mood. Changes in mental state can be visible in behaviour change, for example, becoming more withdrawn or becoming irritable. Sometimes it's easier to notice these changes in colleagues than in ourselves. If you are experiencing burnout, then recognising this is the first step. Insight into changes in mental state can be difficult to achieve, particularly when unwell. In an occupational context, raising the issue of burnout in the workplace is the only way to make work more sustainable. This is because work-related stress is upstream of the burnout. But as well as addressing the factors leading to the burnout in the workplace, an individual may also require clinical input, including psychological support, and in some cases, if also experiencing other mental ill health, such as anxiety and depression, medication treatment too. Anyone experiencing burnout should therefore be reviewed by a treating clinician for assessment and any treatment as appropriate. One thing to acknowledge is that it can be difficult to raise burnout in the workplace, particularly while mentally unwell. Occupational health input is helpful in managing this as a neutral, professional, and evidence-based forum for support. Ultimately, burnout affects individual and organisational performance, so it will be in an organisation's interest to address it too. Thank you for watching. Here are some references and further resources.